The idea is that you have an operation and you have a metabolic change, a fundamental change in the way your body governs metabolism. And that's done through important hormones. These hormones happen to be housed in our guts, in our digestive organs, as well as in the inside fat that we all have. We're not talking about what people see on the outside. We're talking about what's going on the inside. What happens is the effect for the diabetic patient is that they have the surgery and right away their body does a much better job of sensing sugar, glucose, and handling it differently and better and the way it always should have been. So in the sleeve operation, what happens is we remove a large portion of the stomach. But it's not just making the stomach smaller. That's like the bariatric concept. What happens in that operation is the reservoir that's left behind that most people have seen, that's in the shape of a banana or a comma or a half moon or whatever you want to call it. That reservoir that's left behind now has a different function. It empties more quickly. And that's critical because that emptying stimulates the small gut. And that stimulation of the small gut is a critical mechanism for turning on the body's better way of signaling when it comes to how people handle sugar. And so for the diabetic patient, that can mean that they have surgery and their diabetes is greatly improved or even what we call in remission. In the gastric bypass, which is the second most commonly performed operation now in the United States, what happens is that we create a small thumb-sized reservoir and we do an intestinal reconstruction. So again, we use this small reservoir to directly and quickly stimulate the small gut, which leads to the same changes that we just discussed in the sleeve. We have an additional mechanism in this small intestinal reconstruction of creating important signaling that's happening because of the bypassing of most of the stomach and the upper small intestine. So you have sort of a dual way that the body turns on this signaling process in a gastric bypass patient as opposed to the sleeve patient. But both surgeries are very beneficial and very helpful in terms of improving diabetes for the patients.